being here again. Good afternoon, everyone, and thank you for being here today for this press conference. And I have with me today Dr. Alex Bu of the Louisiana Department of Health, and also Butch Browning, who is the State Fire Marshal. We're at GOSEP today because they had a UCG meeting here this morning, and then a video telephone conference with the Vice President and the White House Coronavirus Task Force that lasted until a few moments ago, during which Dr. Birx, of course, many people presented information, but Dr. Birx again said that what appeared initially to just be modeling, but now appears to be working in terms of reducing the transmission rate, are those mitigation measures that she stressed on her visit here, and that is to close bars, limit social gatherings, limit indoor dining at restaurants, promoting outdoor dining, takeout, and delivery, and the most important was universal mask mandates, and that's critically important. Any state where you have a high incidence of cases, meaning more than 100 cases per 100,000 residents, and positivity over 10%, and of course that is the situation here in Louisiana. Today, the state is reporting 1,125 new cases of COVID. That is a total now since the beginning of 111,038. Today's report was on a total of 16,282 tests. 91% of today's cases come from community spread, only 9% from congregate settings. You will notice that 1,125 new cases, although that is still a very high number, it is lower today than it has been over the last several days, and that's certainly a good thing. But one day does not a trend make, and so hopefully we will stay moving in that direction going forward. We are seeing early signs, at least, of a plateauing of our cases, which is obviously a good thing, because I think before they're going to come down in a sustained way, they're going to have to first plateau, but they're plateauing at a really high number of cases each day. We obviously, every 7 days or so, we get really deep into the weeds on the data. We're going to be doing that again later this week to look at all of the hospitalization information, all of the cases, the positivity by state, by region, you name it. We are now 2 weeks out from the last mitigation measures that were imposed, and I believe that we're starting. Won't know that for sure for a while. We do know there's typically a 2-week lag time between when behavior changes and when you see that in the numbers. And that was one of the main points that was brought out today by Dr. Fauci on the call. Unfortunately, today we're also reporting 26 new deaths. That brings the number of deaths to an even 3,700 since the beginning of the pandemic. Obviously, that's an awful lot of our brothers and sisters who have died, and we need to continue to lift up the family members of those individuals in our prayers. Today, we also have 1,583 patients in the hospital with COVID-19 across the state of Louisiana, 214 of whom are on mechanical ventilators. For me, if there's any good news over a period of time in today's numbers, that number is it, because basically over the last 6 days, our hospitalizations have been flat. And that's the first time that that's happened in a very long time. And hopefully that is the beginning of a trend where the hospitalizations don't continue to climb and ultimately will go down over time. You should note that Louisiana is now ranked number 1 in the United States per capita for cases of COVID-19. We knew we were on this trajectory over the last couple of weeks and would get there if we kept reporting those daily case numbers the way that we were. It puts us ahead of Arizona, now the number 2 state. New York's number 3, New Jersey is number 4. And that per capita ranking should be an alarm bell for everyone to fully understand just how serious this pandemic is here in Louisiana and how much COVID-19 that we've had, literally from the beginning. Unfortunately for Louisiana, we were one of the states that had the highest growth rate in the country back in the March-April time period, and we're really the only one of those states that had a significant issue with COVID-19 then that's also having it again now in this resurgence. And so there's no doubt in my mind we have more of this virus in Louisiana today than we've had at any point thus far. And I would also ask you to look at that a different way. If you take the number of cases out there and subtract the recoveries, you will see about a 50,000 difference. The difference is 50,000. That is much higher. That is 5 times higher than it was about 6 weeks ago in terms of the active cases. And know that we're only talking about confirmed cases, those with a positive test result. We don't know the exact number, obviously, but the best guess is somewhere between 25 and 40% of all COVID cases are asymptomatic, and practically speaking, almost no asymptomatic people are tested. And so they're not in these numbers. And even though they're asymptomatic, they are infected and they are infectious. And so that's a real challenge for us here and elsewhere around the country. So it is more important than ever that people adhere to the restrictions and the mitigation measures. Everybody has a role to play, so please wear your mask, wash your hands frequently, social distance, stay home when you're sick, and limit your movement. You know, they're just, if everybody would cut at least in half the number of times they leave their homes, that would have a tremendously positive impact on reducing the transmission of this disease. We are hearing from our regional medical directors and others that they are seeing an increased adherence to the mask mandate, which is a great sign. We know that it works. Wear a mask, stay 6 feet apart, and we need to keep it up. I also know that there are individuals who are concerned about unemployment benefits, especially with the enhanced $600 a week benefit that we've seen since the first act by Congress. And I know that this is the last week where we have unemployment benefits, federal benefits at that level. And then hopefully Congress will pass new legislation soon in order to have an additional period of time with an enhanced benefit for unemployed workers. I also have a concern here in Louisiana with the solvency of the Unemployment Insurance Trust Fund. And over time, when you pay out more benefits, as we obviously have been doing throughout the course of this benefit, you run down the balance of that trust fund. And you get ultimately to an area where if you break below $100 million in the trust fund, then the law triggers an increase in taxes on employers in order to replenish the trust fund and try to ensure the solvency. Further, if you get to a point where you have to borrow from the federal government, that borrowing is available and it's interest-free, but at the same time you borrow, you have to set up a mechanism to pay it back, and so then there's a surcharge on employers. This is obviously not a good time to be imposing any additional taxes or surcharges on employers and their payroll. And so I've contacted all of our congressmen to make sure that they're aware of this concern. And by the way, this is not just a concern for Louisiana. We're in practically the same situation as every state in the nation. And in fact, at the outset of the pandemic, we had the 17th strongest trust fund, unemployment insurance trust fund in the country. But as they get together in Washington and try to figure out what phase 4 is going to look like in terms of the legislation that they're going to pass and that they're starting to discuss now between the House of Representatives and the Senate, it would be awfully helpful to Louisiana, to every other state, most importantly to workers and to businesses, if there's assistance for states for the unemployment insurance trust funds to make sure that those are shored up and those tax increases do not become necessary. Another way that we can help business owners and employees during this time is through the Main Street Recovery Program. That program began accepting applications today. This program was created by a bill that I signed into law that designated $275 million of CARES Act funding for small businesses with 50 employees or fewer who had a business interruption because of COVID-19. Businesses that haven't received financial assistance from other sources have priority for this funding during the first 21 days of the program. Applications started coming in today. Other applications for those businesses that have received other forms of assistance, they will be considered, I think, starting on August the 18th and thereafter. So businesses may be eligible if they incurred interruption, disruption, unplanned expenses, or extraordinary costs associated with COVID-19 or the public health measures put in place by state or local government officials. The Treasurer's Office is running the program. I saw some media reports today, and if they were correct, I think there were more than 10,000 applications today for that program that shows just how much the aid is needed. So for more information, I encourage business owners to go to LouisianaMainStreet.com. That's LouisianaMainStreet.com. While we know that the vast majority of business owners are working hard to comply with all the current restrictions, we have had to suspend some alcohol permits from a few establishments that have repeatedly and after numerous warnings continued to be non-compliant. And so I'm going to ask State Fire Marshal Butch Browning to come up and speak more on this, and following that, I'll come back up. If you do have questions related to this or anything else related to the Fire Marshal's office, I would ask that you bring that up whenever Fire Marshal Browning is up here speaking. Thank you.
Thank you, Governor. The role of what the Fire Marshal has been doing in partnership with the Louisiana Department of Health sanitarians as well as the alcohol tobacco control agents have been work to go out and trying to work with businesses to help them understand the guidance. You know, first and foremost, what I want to say is the businesses, vast majority of the ones open across the state, have done a phenomenal job of not only implementing these mitigation measures and all of these things that stop the spread, but in many cases they've exceeded what the state has asked of them, and we certainly appreciate that. Over the past 4 months through opensafely.la.gov, we've communicated with thousands of businesses, pushing information to them to give them the information that they need to not only keep their employees safe, but keep their customers safe. And it's just not fair for the good businesses out there who are doing their best to help the state, help our citizens, and help our country recover from this pandemic when you have these bad actors out there. So it not being fair, we've developed a system to where we have gone out and we have worked with businesses. We have given them many chances to modify what needs to be done. But at some point, and we found that this weekend, we had 4 businesses, one of which was serving alcohol on premise. The other 3 were businesses that should not have been open because there were bar rooms. As a result of that, the Alcohol Tobacco Control Agency has suspended those 4 licenses subject to a hearing. And those locations are the Sand Dollar Tiki Hut in Grand Isle, the Frosty Factory Bar in Lake Charles, Voodoo's Bar in Harvey, and the Pelican Pub Bar in Gonzales. Now, they're scheduled for hearings on August 5th and 6th, and the result of those hearings could be a 30-day suspension of their alcohol license. But all in all, and I think the governor stated it, this is a call for action. I mean, the social distancing requirements, the capacities in buildings, the mitigation measures of wearing a mask, the simple hand washing, the staying away from people is paramount. And these bars being closed is important for Louisiana to get back to where they were. So I just want to reaffirm that Our goal is to work with people, and we have been educators, we have been stewards of goodwill, and we have worked with people, and we're going to continue to do that because I believe regulations and enforcements and all of these type of government controls that keep the right kind of order, it works better when people voluntarily comply. And I've said it before, we've had better compliance with the COVID mitigation measures than we might perhaps have in normal times when we enforce the fire code because people believe in this, and I certainly appreciate that. But we will remain proactive. We will continue to go out and make these visits on a daily basis to make sure that, number one, people understand and people can comply, and we can together change this. But in the event we have people who don't comply after chances, there are consequences.
How many visits have y'all made to businesses, and how many businesses have received citations or anything besides these four with the alcohol permits?
So these are the first 4 businesses that's received what you would say would be a penalty. Our normal visits, we leave a written report, and it just memorializes the expectations of both the business and, of course, our inspection. So these would be the first 4 that actually saw something punitive, which indicates, number one, the problem is so severe that we had to cite these people. But I think it also indicates that, again, the vast majority of the businesses are trying to do the right thing, and in many cases exceed.
But how many visits have you made to businesses to check on compliance and the courtesy checks and all that? I mean, how many visits are we talking?
Sure, we've probably made over 5,000 visits across the state since Phase 2 began.
Can you walk through exactly at what point you would revoke these licenses? Is it after you go 3 times and warn them and they're repeatedly, is there a number and if so, how many businesses have you found violate the same thing twice?
So we created a matrix that made sense, that kind of fundamentally worked on a 3-strike, you're out. And that's pretty much what we followed. The only exception would be if we go somewhere and someone just blatantly does something that's egregious. That may be a 2-striker, but we have not dealt with anyone on a first mistake. It's kind of a 3-strike and you're out. We probably have about 14 businesses right now that are on a 2nd strike. And we're going out and working with them, and actually, I think one of them today is actually complying. So it's not a problem.
So the 4 ones you closed, were they all 3-strike businesses?
Correct.
How were you alerted to the problems at those 4 bars? Was it through the Open Safely portal, or was it just physical observation? How did that happen?
Yeah, I can't answer all 4. I know that some of them were actually complaints that brought us out there because, we started getting proactive a few weeks ago doing more courtesy checks, but I believe the vast majority of those began with a complaint.
You're suspending the liquor licenses, or if they get suspended, is that 30 days? Does that cover a time when that business maybe can't be open anyway because of restrictions?
So as I understand ATC's process, it's suspended now. Once there's a hearing, depending on the result of that hearing, it could be suspended for 30 more days.
Right, I guess I'm asking if the business is not supposed to be open anyways, is that part of their
The
suspension?
businesses aren't closed, they're closed to on premises.
Right. So so the business can be open for off-premise sale only, no on-premise. So in these cases, they were either doing on-premise or they had people inside the bar, maybe violating the order, the current order.
Can you explain the balance between, these companies that are doing the wrong thing and you've got to penalize them, but on the other hand, these are business owners and perhaps employees who are suffering because they didn't do the right thing?
Well, I mean, I think the balance is we have rules for different businesses, not just bars. And in those rules, I mean, we're expecting people to operate within those rules. So that's really the balance. And it's all balanced on the science and the directive we're getting from Washington, D.C. to specific risk in Louisiana.
I understand you guys do proactive checks and responses to complaints. Can you talk about the level of complaints you've gotten and what you've seen on those proactive visits regarding the mask mandate since that went into effect, and specifically like the public wearing masks when they come in as customers?
Yeah, so and I think the governor alluded to this. Over the last week, we've seen more mask wearing. We've had a lot less mask problems. We did about 840 inspections Thursday through through Saturday, and we had 73 violations. The vast majority were mask or some social distancing, but still in all, that was a lot less than what we've seen in the past. And I don't have those exact numbers, but we see more mask wearing, and we understand it's a personal responsibility. I know people that I'm around, I see them with the habit of wearing a mask where they didn't. So I think the message is getting out on mask wearing.
Geographically speaking, how spread out are these checks? Are they mostly focused on East Patrick Parish, Orleans Parish, or are you seeing this across the state?
No, it's statewide. We're giving the fair attention all over the state.
So Butch, thank you, and thank you to the men and women of the Fire Marshal's office and all that you all are doing. And I'll just reiterate, there's nothing easy or painless about making a decision that puts a restriction on any business, whether it's the hours of operation or the percentage of occupancy or anything like that. But when you have a public health emergency that is basically unprecedented in its scale, you have to take those measures that are designed to promote public safety and designed to keep the maximum amount of the economy open. Because what we cannot do is allow so many people to become infected that we lose the capacity to deliver life-saving health care. And that's what these mitigation measures are about. That's why the White House Coronavirus Task Force looks specifically at situations like we're seeing here in Louisiana, not exclusively in Louisiana, but across the Sun Belt. And made a recommendation that we close bars, and it's unfortunate. And we closed them to on-premises consumption, and so we wanted to allow them every opportunity to safely engage in business that they can do with respect to delivery, curbside pickup, that sort of thing. So these are very, very tough restrictions, and I'm aware of that. Nothing easy or pleasant about that, and I apologize, but they are absolutely necessary. And in fact, there is no method available to us to get to a transmission rate of less than 1, which means that the disease is actually starting to dissipate across the state of Louisiana. You cannot get to a transmission rate of less than 1 without the mitigation measures that include mandatory masks, and bar closures. I mean, now if we want to go back to a stay-at-home order, well, that the bars were closed then too, but that's the only way to do it. And so this is the best thing we can do for the economy overall and for public health. And but that doesn't make it easy. I do want to take a couple of moments to talk about testing before we take your questions. First of all, I want to thank everybody involved, from Dr. BU and the folks at the Department of Health, all of our hospitals and clinics and other partners, because we've actually conducted more than 500,000 tests in the month of July. With 3 days left in the month, we're at 547,000 tests. Remember, the monthly goal is 200,000. And so a lot more people have been tested. That certainly is a good thing, because a case exists whether you test for it or not. It's just the test gives you an opportunity to identify the case and then identify the contacts, get the individuals into isolation and quarantine and so forth, and try to minimize the spread. But just like we're doing a lot more testing here in Louisiana, and I believe the fact of the matter is, across the country, we've increased our testing in the month of July more than any other state in the nation on a per capita basis. But every state is increasing their testing. And so this has put a tremendous demand on commercial labs especially. And what's happened because of that demand and because of shortage of reagents and some other issues, the turnaround time for those tests has gotten longer than we would like it to be, longer than anybody would like it to be. And because you want the test results to come back as soon as possible, so that individual knows and so can remember who they made contact with, and you can contact those people before they may become contagious and that sort of thing. So we're going to be working to get those turnaround times down. The federal government has a major push on that as well. Admiral Giroir mentioned that today. But we do need to prioritize those people who are being tested as those who are symptomatic and those people who have made contact with someone who has COVID-19. No one should be getting multiple tests in order to return to work. The CDC has come out with guidance that says this, and LDH put out an alert to all healthcare providers last week saying the same. As we've said before, you cannot test yourself out of quarantine. If you're waiting on a test result, stay home for at least 10 days past when you were tested. If you are symptom-free after that, you can resume your normal activities, including going back to work. If you are curious or concerned but don't have symptoms or known exposure to someone with COVID, then we encourage you to visit one of the federally supported surge test sites. And to learn more about where they are and how to be tested, you can go to doineedacovid19test.com, doineedacovid19test.com. There are specific sites that are federally sponsored, and they are part of a testing regimen where you can be tested if you have symptoms, if you don't have symptoms, if you've had contact with someone, or if you haven't had contact, just because you want to be tested. And so you can go to doineedacovid19test.com, figure out where those surge sites are. Starting tomorrow, we're bringing another surge site online in New Orleans. These are all being done in partnership with the U.S. Department of Health and Human Services, and the Louisiana National Guard is actually administering the sites. This is a sort of a pilot to see if by blanketing a community with testing, you can jump on top of those increasing positivity rates and really start to turn those quicker than would otherwise be the case. Thus far, through federally supported surge testing, we've been able to test 46,265 Louisianans since the first week of July. Unlike the community testing sites, the federal testing sites provide a come one, come all testing opportunity that I just mentioned to you. They have their own commercial labs that they are doing their work for them, and the test results turn around in about 5 days. I told you all on Thursday that I had been tested at the site at the Welcome Center over on the Capitol Complex. I tested Thursday at noon. Last night about 4 o'clock, yesterday afternoon about 4 o'clock, I got an email telling me my results were in. And I think that's similar to the experience of most people. The first week of surge testing in New Orleans will be administered at the UNO Lakefront Arena and will be drive-through only. In the weeks to follow, the program will be available Monday through Saturday and will move to different sites around the region as drive-through and walk-up testing. In closing, I want to remind everyone to wear their mask, social distance, stay home when you're sick. Remember, you're safer at home. Limit the activities that you engage in outside of your home. And if we'll all do these things, we'll get back on top of these numbers sooner than would otherwise be the case for sure. And I hope that we're beginning again to start to see those numbers flatten, and then that's a prelude to when they actually start going down. I do want to remind everybody we're in hurricane season. The National Hurricane Center is tracking potential tropical cyclone 9, which is still out in the Atlantic. Right now, the tracking has that storm turning northward and going up the east coast, but we never know because it's still far enough out. But whether it's that storm or another one, we have every reason to believe that we're going to have a busy hurricane season. So please pay attention to that and go to getagameplan.com. So with that, I'm going to take a few questions. Yes, sir.
The White House Coronavirus Task Force has obviously suggested that we actually roll back indoor dining a little bit more to 25% to 50%. I'm wondering if this plateau continues to play out. Do you think that means we're good at the current level of restrictions we have for now? I know you have a new deadline for renewing the order coming up.
Yeah, obviously we're going to follow the numbers as it relates to tests, to cases, to positivity, to hospitalizations, deaths, all of those numbers. And they do talk about reducing on-premises dining, inside dining, I should say, and favoring things like outdoor dining. And I do want to say that. We've said it numerous times. Any activity that you undertake is inherently safer outdoors relative to indoors. So dine outdoors if you can. If you can't, pick it up, take it home, take delivery. But we have reduced our capacity for indoor dining to no more than 50%. And the 50% operates as a cap, because within that 50%, you still have to be able to socially distance. And so we, quite frankly, don't see a difference between social distancing and 25% or social distancing at up to 50%. And that's one of the reasons we haven't made that change to go to 25%. We've left it at 50%. But obviously, we're going to continue to watch the numbers, and the steps we take next will be driven by those numbers. We're going to be driven by the data, and we're going to be driven by the science. But whether you're talking 25% or 50%, if there's a requirement within that number to social distance, and that's defined as that 6 feet interval between individuals who are not from the same household, then we don't see a difference there.
Do you think it's possible to reopen bars before there's a vaccine?
I don't know the answer to that, and I want to believe that there's a way to do that. And when you say reopen, I know you're talking about to on-premises consumption. I'd like to believe there's a way to do that. Our experience wasn't good here. It wasn't good anywhere else around the country. But we're going to see what might be possible going forward. We know that right now, when we have high incidence levels of cases throughout the state and positivity that exceeds 10% throughout the state, that now certainly is not the time to entertain that. Yes, sir.
This is really the first time that we've seen the state issue penalties to businesses since this fight against the virus began. Was there ever a discussion where you guys said, okay, it's time to crack down, or did it just time out that way, that now is when the penalties begin?
Well, we obviously try to be very patient. We try to get compliance with measures, whether they're voluntary or mandatory, and so forth. But there obviously have been some violations that are repeated enough or flagrant enough that you just have to take more serious action. And I think you can properly gather from what the fire marshal said earlier, is we've made every effort to communicate with these business owners what the restrictions are, what the mandates are, and try to gain their compliance. And the overwhelming majority of businesses will do that. And when they're out of compliance, in many cases it is not intentional, and when you bring their attention to the particular requirement, they will get into compliance. But unfortunately, we've had some who have chosen not to do that, and because this is so critically important, and now is such a pivotal time, we felt it was necessary in order to close those establishments completely, give them an opportunity to have a hearing. They ultimately may get their license back and can operate without the on-premises consumption, but that'll be something for the ATC to determine when it conducts its hearing. Yes, ma'am.
As part of the congressional debate in the Senate right now, the Republican plan would do away with the $600 enhanced federal unemployment benefit and replace it with $200, and then later to 70% of whatever people earned when they were employed. Do you support that approach? Do you think it's too little? Can our unemployment system handle doing the 70% calculation?
Yeah, well, the second part of your question is easier for me to address because it's not just the state of Louisiana. I'm not aware of any state unemployment system where we can handle variable benefit amounts based upon what the employees' earnings were in a previous year. They're just not designed to function that way. And so what we are encouraging the Congress to do, and I'm certainly encouraging our delegation to do, is when they arrive at a benefit amount to do it at a flat amount, and everyone in Louisiana would get that amount, because we know we can administer that system, and our system is designed for that. If they go beyond that, I will tell you, it will be very, very difficult to administer. I know that what we have right now is a bill that came out of the House of Representatives a couple of months back that would keep, as I understand it, keep the unemployment benefit at $600 through the end of the year. And then you have a bill that's been announced in the Senate where it would go down to $200. I suspect what you're going to see, just like you're going to see with every other area of disagreement, is something in the middle of those two numbers, or I shouldn't say in the middle, but between those two numbers. And I just want to bring their attention to the fact that the trust funds across the states, and certainly here in Louisiana, have dwindled down, and nobody believes this is a good time for a tax increase or a surcharge to be passed on to employers. And so I would encourage the federal government, as they're looking at unemployment benefits, that they also look at unemployment insurance trust funds. And I know this is something that the National Chamber of Commerce is working on, and many other business organizations as well. But it's critically important that we address that also.
Do you think $200 is enough? $200 a week?
I don't think $200 is enough. And now you got to understand, they do get the state benefit on top of that $200, and then there's the pandemic unemployment assistance in addition to the compensation. And so you kind of have to look and see how much of this survives the next piece of legislation, and where we're going to be. But obviously, we know, just like businesses are hurting, we have individuals who, through no fault of their own, are hurting too, because they cannot work. And typically, when you have an unemployment benefit, that money is pumped directly into the economy. I don't think you have unemployed workers out there trying to buy stocks and bonds with what they're getting in unemployment benefits. Yes, sir.
You mentioned this in your remarks a little bit. Wanted to see more of what you make of it. Obviously, this today with the 1,125, the lowest amount we've seen
Yeah.
in about 3 weeks. I know obviously one day doesn't make a whole lot of change on its face, but we also saw. What do you make of it when we also saw for the lowest amount of tests reported in a 24-hour period, about a week, only 16,000, which is the lowest figure we've seen in a day-to-day increment since at least last Monday. Kind of, what do you make of these low numbers? I know it's
Yeah.
early, but
I try not to make too much of one day's numbers. That's why we try to take like rolling averages of several days to kind of see what we're doing and what we're not doing. But having said that, the percentage of positive tests of the total tests given today is lower than it was yesterday when we had a higher case count. And so you want to take that as being a measure of good news. We also know that hospitalizations over the last 6 days have been flat. And when I say been flat, if you compare today's number to 6 days ago, it's only a difference of 2. Now, within those 6 days, it went up and down, but overall, it's flat. Knowing that we're 2 weeks into the mask mandate, I'm really hopeful that these are signs that these mitigation measures are starting to pay off. And hopefully by Thursday, we'll know more because we'll have additional data. And understand this too, we report things by date of specimen collection. And because there's a lag time between when tests are submitted, specimens are submitted for testing, and when those results come back, every day when we get new results, we have to go back and associate those results with the date of that specimen collection. And so we learn more every day, not just about that particular 24-hour period, but for the last really 14 days or so. And we get a much better idea about positivity, cases, and all those sorts of things. And so that's another reason why nobody should look at any one day's report and draw too many inferences from it. And we should take those things on rolling averages, somewhere between 3 days and 7-day rolling averages, in order to see what we're doing. Yes, ma'am.
So, could you speak to the testing initiative or lack thereof in parish
Oh.
prisons and local jails?
So ask the question again, I'm sorry.
Could you speak to the testing initiative for COVID in parish prisons and local jails? Can you speak to if there is testing going on in
Yeah, I'm sorry, I don't have my big notebook with me, but I got briefed on it today. There's testing at jails, and there's testing in the prison. In fact, they will test entire wings. They're testing their staff. And by the way, I'm very sad to say that we lost, I think it was our 5th corrections officer over the weekend to COVID-19, and that was a worker at Angola. But there is testing at all of our state prisons and in our parishes, both as it relates to pretrial detainees, those who are not in state custody, and those who are state inmates being housed at our parish jails. In the word that I got this morning, we have 2 state inmates who are actually in the hospital, just 2 currently with COVID-19.
Could you speak to the case rate and mortality rate for incarcerated people in Louisiana?
Yeah, well, I can't with any precision. I don't have the numbers in front of me. I want to say that there have been 16 fatalities of inmates since the beginning out of our 3,700 now. There have been 16, I think it is, inmates who've died. As I mentioned, I think we're up to 5 correctional officers who have died. And so how that equates into a rate, I don't have that information with me right now, but we can get you some additional information on that.
Yeah, I love that.
Sure.
Last question.
All right, I'm going to go back here.
So, Governor, what do you suggest to someone who works for an employer and the employer won't allow them to stay home if they're sick? Because I'm seeing a lot of Facebook posts and things about that, or if their
Yeah.
employer isn't sanitizing their business, and is there some sort of resource you can do or dealing with that?
You know, I guess I would just encourage all employers out there, everybody, to be as responsible as they can be. We know that the most important things we can do to get on top of this virus and to promote public health and to minimize the number of cases, minimize ultimately the number of deaths, are things like wearing the mask, social distancing, washing hands frequently, staying home when you are sick. And if you're telling your employees that you expect them to come to work when you're sick, then you're exposing yourself and all of your other employees and whatever customers you may have to an unreasonable risk of contracting this particular disease. It just doesn't make any sense to do that. Luckily, the vast majority of people who get sick aren't sick of COVID, but the number of symptoms that are consistent with COVID have grown so much since the early days that it really is hard to distinguish between sometimes what is COVID and what is some other common ailment. But having people stay home, because we have good reason to believe that they're most contagious when they are actually symptomatic that way. And so I would just encourage them not to do that, and it's just not worth it. It's not worth it for anybody, and certainly we encourage all businesses and the public sector as well to routinely clean surfaces. I mean, much more than we've done in the past and so forth. And there's some other things that just make a lot of sense. Make sure that your restrooms that your employees and your customers use have plenty of soap and paper towels and so forth. Because if you're telling people we want you to that they need to wash more frequently, then you have to resupply those things more frequently as well. All these things are incredibly important, and they're all going to be necessary if we're going to get back on top of these numbers without having to impose even more restrictions and closures and that sort of thing. So we're going to be back on Thursday, but not back here. But we're going to be back together on Thursday, I think, back over at the Capitol. And we're going to schedule that for 2:30 for our next press briefing. Although this room is actually pretty well set up for it. I don't know if you feel more comfortable in here or more safe, but I think you probably are. But we won't be back here this Thursday. I do look forward to seeing you again later this week. And before I leave, I just want to encourage the people of Louisiana. You know, we've had high case numbers before. We've had a lot of people in the hospital before, and unfortunately, we've seen an awful lot of people die. We got on top of it once before. We can do it again, and we can do it without going back to a stay-at-home and without closing more businesses and so forth. But it really is going to require all of us. Every single person has to do their part. And as Dr. Burke said today, there is no bigger mitigation measure, no more important mitigation measure, I should say, to doing that than this mask. So I'm encouraging people to do. In the grand scheme of things, it's a minor inconvenience to somebody when you know that by wearing this mask, you greatly reduce the likelihood that you're going to transmit COVID-19 to someone else. And when they wear the mask, then they're not going to be transmitting it to you. It's called being a good neighbor. And so I'm just going to encourage everybody to continue to be good neighbors. If you haven't done it yet, it's not too late. Start wearing your mask. It really is important. So thank you, and we'll see you on Thursday.